And new data shows fever temperatures across the nation are going down, leaving some to speculate we will soon see a drop in new virus cases. Here's One America's Jack Posobiec.
We're very excited to welcome here to One America News again Will Chamberlain. He's the editor-in-chief of Human Events. Will, Human Events has been out in front on coronavirus, your coverage, talking about the issues with the China cover-up, talking about the need for testing, the need for masks. Tell me, what are you looking at now in terms of this situation and some of the new indications we're seeing with this virus outbreak?
Well, so obviously you generally want to look at things like hospitalizations and the utilization of intensive care units to kind of figure out what the strain is on hospitals. But the big thing that I've been looking at lately that's given me reason for optimism is nationwide temperature data, actually like how many fevers people are getting from a company called Kinsa. So this company, they make thermometers that are internet connected, and as a result, they have a huge amount of data about where temperatures are rising, where more people are recording fevers. And what they've shown is that in the last couple of weeks, there's been a dramatic reduction in the number of people who are taking their temperature and getting a fever using these thermometers. And that's that's an even greater reduction than we'd expect to see with the decline of flu season.
So essentially, we're seeing this idea that these widespread temperature gauges, they're going out there, they're looking around the country, what's going on, and they're seeing this on a national level, that it's being reduced over the past couple of weeks.
Exactly, right? Which would make sense given the fact that the country's undertaking this massive social distancing. And just kind of like we saw in Hong Kong, where when they started putting in place social distancing, not only did their coronavirus numbers go down, their flu numbers dramatically went down as well. I think we're starting to see the same thing and see that right now fevers are going down, which suggests that hospitalizations will go down and deaths will start going down in the future.
Now, with that going on, does it sort of lend state leaders and health officials to start to be able to look at certain areas where we might be able to see a lessening of social distancing concerns, and then other areas where they would want to continue them, where there are larger outbreaks?
I think you have to wait until you see the full effect of hospitalizations before you start taking off the gas of social distancing, right? Because really, again, there's this big lag. Somebody who's getting a fever today is going to be in the hospital. It might be one of the people who's in the hospital, but not for another couple weeks, right? We know that coronavirus has this really long lag time, that it takes a long time for the severity to really hit. So you don't want to, get ahead of yourself and get rid of the social distancing measures only to find out that you've just let it spread a bunch, and then 3 to 4 weeks away, you have a huge crush on your hospital system. So I think what they'll do is they have a reason for optimism. It's reason to keep the social distancing measures in place for the short term, but then once expecting to see that peak in maybe mid-April, like President Trump has predicted.
Doctors are prescribing this hydroxychloroquine, azithromycin cocktail. They're trying other things that have already been approved. The FDA did an emergency approval. Does it make sense then that they're prescribing them as early on as possible with these infections?
Right. Well, with any antiviral medication, you want to take it early on in the infection. For example, when you're taking Tamiflu for any kind of flu, you want to get it early on because that's when there aren't that many viruses in your system and it has a better chance of just knocking the virus out. That said, I think there's a lot of reason to be optimistic. It seems like this drug cocktail is working a lot better than a placebo based on sort of early data, although we don't know absolutely for certain. And, the more time that goes on and the longer we have, the more we're going to have in terms of, medical weapons against it, not just vaccines, but, antiviral therapies, maybe antibody therapies. There's a lot of things we'll be able to develop. And the enemy here is time. Like the problem with this virus is not necessarily that it's so deadly, but that it's so fast and that it's really putting pressure on us to kind of quickly meet the technological, essentially, demands that it's imposing on us.
What do you think that we're going to start to see after that next 2 weeks window hits?
Well, I think then you're going to start seeing daily new cases will have declined pretty substantially, and daily deaths will start to decline, and that will suggest that we're on the other side of the epidemic curve, and that we're looking at possibly opening things up on May 1st, as the president has suggested.
Want to see more videos like this? Click on the link below and subscribe to One America News on YouTube, and call your cable provider and kindly demand that One America News is added to your lineup. Call and subscribe today.